What this community is about bringing together people who are connected at heart, who have a deep care for the human family. The Atlantic Fellows Solidarity Grants were developed in response to the urgent need in relation to the COVID-19 pandemic. Initially, the Institute ran a number of conversations with fellows, Zoom calls, and those calls were harrowing. Harrowing in terms of what fellows were going through in every corner of the world. And as we listened, we also listened to the need that was emerging. And the need was very much about supporting fellows to pivot urgently to supporting their communities, to minimise the impact of COVID-19. It challenged the Institute to do more than listen, to provide the space for fellows to know that they weren't alone. So as countries locked down, what that meant for some communities was that it absolutely wiped out their access to food.
We are not only in a health crisis with COVID-19, we were also in a hunger crisis. People were going to bed hungry. One of the things that we identified is that we need to get every household to have a backyard garden. We provided communities that needed support with food, with fresh produce, dry goods. We also provided them with seedlings.
I feel excited because of now we know that we have our own thing that we made by our hands. So we applied for a solidarity grant to support and incubate a project where beekeeping can be another way of making sure that food that is distributed to people is nutritious enough. It has benefited them a lot. So we see community responsive and they're responding positively.
We have also set up a mobile education and social connection platform for parents of kids with disabilities, which we call the Parent Network. We've been making videos to capture their own knowledge, but also to spread it within the Parent Network. The grant has definitely been a catalyst to take that forward and to make that a real thing.
Having people who are really stranded to come and fetch water from the tanks that the Atlantic Institute has supported us with.
This has really helped a lot in so many different ways.
The idea was that if we start building a natural building, some of the community members could also have a space to share with their children and remain staying hopeful.
Yay! Many of these fellows were already dealing with the most horrific conditions and outcomes as a result of inequities, because that's their work. They were already doing that work. COVID hit, and it wasn't, this is just all too much. It was bring it on. Why? Because our fellows care.
I used the Solidarity Grant to build 12 video interviews designed to bring a more open communication about the pandemic, diversifying the narratives and trying to address the misinformation that we were facing.
São Paulo is a big city with a lot of inequality.
This project aims to test the feasibility of a remote cognitive assessment that will be offered for elderly people from a public hospital from São Paulo.
In this moment, it's very important for us to make a stand and to give voice to these people.
This project offers social activities for people with dementia and aphasia post-stroke in a remote way. We are using the money that we received to buy and donate tablets for the participants and also to pay internet access for them.
We use the game design as a way to push the brain performance. The exercises are always challenge the brain of the user, and we are pushing them to train their brains, to improve their brain health and promote their health in a general way.
Qigong ultimately is about opening your heart.
When we applied for the Solidarity Grant, we realized that we really wanted to make sure that more people could participate in this kind of healing, movement, creativity that connects them across generations.
And over Zoom, for 8 weeks, the group was led with a Qigong specialist and volunteers. And they did these incredible movements and they built friendship.
The COVID-19 pandemic is an inflection point for us to really reimagine and rethink how we provide all types of social protection. There's been a real need, I think, to better understand what has been the impact on those individuals who are providing care.
People who are already sort of living on the margins of having adequate amounts of support now had whatever safety net they had at the time just disintegrate.
We have hopefully helped the communities to just give them a voice and to just include them in research that has a large voice in the academic literature and hopefully also in policy making.
The enormity and the urgency of this racial justice movement really required us to reassess what we were going to do as the Black Funders Network and to pivot. So the grant actually helped us to mobilize in alignment with the national organization and to compile an online COVID resource repository.
It's been breathtaking and inspiring and humbling to observe the work of our fellows, where many across the world were brought to their knees by the challenges of this pandemic. What I observed was fellows' strength, their ability to lift up and try harder.
I couldn't sleep. How could they study? How could they continue learning when their schools are off? So that is why I created this learning packets program in which we distribute learning materials. The grant enabled us to add over 1,500 students in Flores Island and on Sumba Island.
We get the grant to help build a website so we can reach more people. The second one is to help the most risk community, which is the health worker, the elderly, and the street vendor.
Now we are confident. We feel that we are not alone.
Data in the community mapping was used in the forum where the local villagers and the government's representatives were discussing about how they could solve the problem of the village. We try to get some seeds and vegetable seedlings and also try to get some of the rice donations.
The keyword is empowerment. We from outside should act like the facilitator.
We set up an online community where we offer information about mental health and well-being services.
Our Solidarity Grant is support for the SMEs or the community-based tourism hit by pandemic. We are doing series of capacity building session with experts. Our model is quite different. We are not just give the aid or give donation to communities, but they are the main actor. We are not reinventing the wheel, just simple knowledge that they, I think, able to do consistently by themselves.
My goal and my dream is to see every hospital in my country become a more friendly place in terms of how we're gonna change physical spaces to fit the new kind of service that we need in the crisis. Right now, people are so much concerned with a short-term solution, how we're gonna get vaccine, how we're gonna reduce the spread. The next step is how we're gonna improve a better healthcare.
The main work that we do is around LGBTQI human rights and also HIV. This grant has certainly amplified the voices of those most marginalized in terms of their access to health services.
There is a high disparity between the poor and also the rich. I find my purpose in life to diminish this. It is my calling, it is my fire. So we hope by 2030 we can empower more than 1 million people in Indonesia.
I think being an Atlantic Fellow is an absolutely fantastic experience. I found it to be a real opportunity to connect and collaborate with other individuals who care passionately about these same issues.
I think the Solidarity Grant was an amazing opportunity to start to work with technology.
So if we have this understanding of our true nature, then we can be better equipped to move a wall, move mountains.
The next step is to bring those fellows together to support them. What can they learn together? What can they amplify or scale up as a collective as a result of these solidarity grants?
We are in one small world that we have to work on this pandemic together.
There is so much light, there is so much hope. I can feel it in my heart, I feel it in my veins, I feel it in my blood. I see it in my dreams.
What drives me is when I see people realizing their own potential, that all of a sudden they just realize that I am the one that I've been waiting for, that I've got what it takes. This thing is not in just some people, it's in all of us.
Our fight against this pandemic is a global one. It is not a national one, it is a global one. But what's required is exactly what our fellows have, the deep commitment to collective endeavour, not individual endeavour, for the greater good of the world.